Atrial fibrillation, often called AFib, is the most common type of treated heart arrhythmia, and it is estimated that 12 million people in the U.S. will have atrial fibrillation by the year 2030. Dr. Malhotra, what is atrial fibrillation, and what are the symptoms?
So, like you said, atrial fibrillation is the most common most common heart arrhythmia that we see. Most common symptoms are the same symptoms that you would get with any other arrhythmia, would be palpitations or a sensation of your heart fluttering. That would be the most common symptoms. Sometimes if it progresses and becomes uncontrolled, people tend to develop some degree of shortness of breath, exercise intolerance. The symptoms kind of overlap with other forms of heart disease.
Are there risk factors associated with atrial fibrillation?
Yes, absolutely. Advancing age, I think, is the biggest risk factor. In addition to that, if you have a history of other heart diseases like blockages in your heart, history of heart attacks, that is a big risk factor. Then high blood pressure is also associated with developing more instances of atrial fibrillation. More than anything, I think it's being most common arrhythmia in the Medicare population. I think age is the biggest risk factor that we have these days.
Then how do you treat AFib in your patients?
It's most of the times atrial fibrillation is easily manageable. We can control the symptoms by controlling how fast their heart rates are going. So that's sort of the cornerstone of treatment, is to slow the heart rate down to an acceptable level where the patient is asymptomatic. The other aspect of atrial fibrillation treatment is pertaining to the stroke risk, because atrial fibrillation does increase the risk of strokes. So we want to minimize that by putting them on blood thinners.
That's incredible information. And if you want more information, visit health.asante.org.